Creativity for Recovery, Enablement and Wellbeing, which is an innovative project that uses creativity in live performance to work alongside people who've experienced mental health difficulties.
I like the word crew. It sounds like togetherness, doesn't it? You're a crew together.
Well, it's using music, songwriting, recording, video and live performance to reinforce recovery. It's also promoting peer support and enhancing well-being.
In terms of kind of how it specifically worked on Galaxy, we signed the young people up to sessions with you, and they started off with just having an individual session with you, and you just explored the kind of music that they liked, and then it kind of went from there, didn't it, into kind of more group work and ending in a performance.
Even though it does begin with an individual focus, the aim is always to build towards that coming together. That's the real key, I think.
So I think from a clinical point of view, having music as an alternative, as a kind of way to do something much more adaptive and helpful and creative, that is what it brings from a clinical perspective. It's a way of addressing some of the more negative dynamics and replacing them with positive dynamics.
I think also the way music works when you're doing music together, it's a kind of a benign way, I think, to kind of elicit feelings and emotions and bring people together.
If young people have had problems in engaging in regular traditional therapy, not being able to say certain things, they were able to do that through the music. And we saw some examples of that. So I think music's been a way to help them communicate things that they couldn't have communicated in traditional structures.
Songwriting and music is a great way of containing things that sometimes can't be said, or they're a bit challenging. Inside of a song, inside of a piece of music, it has different sort of meaning in a way, and it sort of contains it.
Yeah, absolutely. And then it's really great for the parents to see that, at the performance, or to hear the recordings that get sent to them. It normalizes as well, seeing their child produce something that they can be proud of. A lot of the parents will have been dealing with lots of really difficult issues, and I guess this breeds a bit of normality into parental role.
I think what I use, which is a kind of recording process, gives people an opportunity to want to get it right, so they're kind of concentrating quite a lot. It's quite hard work. I mean, you're singing, sometimes you're overdubbing something hundreds of times to get it right. So that's why I enjoy the sort of songwriting process, especially the overdubbing side of it, because it's a way of getting people to really work hard at doing something. And it's nice, I think it's nice for people to experience that sense of achievement when they've done it.
We've had tremendous feedback from parents, how they've really been so impressed with the abilities, what they've heard, what their child's been able to communicate with them through the music that they might not have been able to communicate with them. And the young people have talked about what a great experience it has been, how empowering it's been for them.
For me, it's also, the highlight is leading up to and around the performance, where people get to share their songs. And so the public, professionals, clinicians get to see them as people, or through their assets rather than their clinical diagnosis. So people are really becoming who they really are. And I think it's a brilliant thing about it.
So shout it from the rooftop.